Hey everyone, my name is Aidan Coffey and I'm a nonprofit management student with a background in disability rights. I would like to thank Columbia and Dr. Smikle for this amazing event. I would like to begin by talking about the recent history of disability. The oldest adopted societal norm of disability is the medical model, coined by Thomas Szasz in the mid-1950s, which views disability as resulting from an individual person's physical or mental limitations and is not connected to the social or geographic environment. Already, this is problematic. The current use of the terms cure and normal paint disability as a problem that needs to be fixed, which has contributed strongly to dehumanizing trends. In fact, a recent NIH study has shown that this perspective has eroded trust in the medical field, as many adults with disabilities continue to express substantial distrust in the medical community. On the other side, there is the social model, which states that the way to address disability is to change the environment and society, rather than people themselves. Essentially, the mismatch is between viewing disability as a problem to fix rather than creating a more accessible landscape. Current government and public health actions reflect a shift towards the medical model, which could have dire consequences for the 7.5 million students receiving accommodations in schools. Specifically, the Department of Education, through the Office of Special Education and Rehabilitative Services, cut around $15 billion from special education funding. While these cuts appear to be related to education policy, they are indicative of a governmental switch towards the medical model, where there is a stronger focus on preventative cures rather than current accommodations for adults with disabilities. If this education-related health policy is a prediction of the future spending plans for the current 70 million adults in the U.S. who live with a disability, there is significant cause for concern. In terms of medical model-based funding, over $50 million was just awarded to research looking for prenatal and external causes of autism, one of the most common disabilities in our country. By no means is this investment in autism medical developments a negative. In fact, many medical professionals would argue that we should significantly increase this amount. However, this action is symbolic of a societal switching towards fixing disability, rather than adapting the environment to be universally accessible. To focus on autism, it was recently reported that only 5% of adults with severe autism live independently, and 37% require overnight care. Recent legislation has cut $1 trillion in federal Medicaid funding, which funds social services for people with disabilities. With these cuts, the safety of millions of adults with disabilities is in severe danger. These cuts are indicative of a shift in health policy away from social accommodations, which is already manifested in local examples. In North Carolina, some Medicaid cuts began October 1st, with 3.1 million residents, many with disabilities, relying on the money for specialized care. An example of an accommodation-based organization that lost 10% of its funding is ABC of North Carolina, a nonprofit service provider that works with people with disabilities. This is just one of many. In fact, by 2034, 10.5 million people will lose their benefits nationwide. Just to show another local example from across the country, in Nebraska, the state significantly reduced the pay of ABA therapists by 37% to 48% across the board, once again showing how a lack of Medicaid funding directly impacts the accommodations people with disabilities receive. These cuts will not stop, and they are felt in every community. Even more, they will continue to destroy the support systems for adults with disabilities, and we need external sources such as the independent sector to make up for it. With the current focus on untested preventative treatments, as well as the slashing of support service funding, it is clear that public health policy is shifting towards Szasz's medical model of disability. While it is incredibly important to note the significance of funding for cures and preventative treatments, it does not provide an excuse to ignore the 70 million adults living with disabilities in our country. Universal design comes from accessibility requirements through laws like the ADA, IDEA, or Section 504, which benefits all people by reducing physical and intangible barriers to access. However, states, cities, and local governments require resources to implement these social services, which will not happen without Medicaid and the Office of Special Education and Rehabilitative Services. With this current shift in funding, the outdated medical model will continue to dominate health and disability-related policy. That is why nonprofit support is so important. Remember that number, 70 million adults in this country. That is why we need organizations, nonprofits, and NGOs such as yourselves to donate time, money, and resources to support and educate people about the community of people with disabilities. I am dedicating this speech to my brother Parker, who is currently an adult with autism who receives government support. For him and for everyone with disabilities, we must continue to fight for inclusion. Thank you so much.